everybody. Welcome back to the I'm with Amanda Medicare podcast. Today we are going to talk about Medicare enrollment or election periods. That those times or opportunities throughout the year where you're able to either enroll in Medicare A and B or make changes to the additional coverages that you have beyond Medicare, like your Medicare Advantage, Medicare Part D, and we'll talk a little bit about Medicare supplements as well. So I do think that there is a lot more flexibility, particularly in New York, for when people can make changes to their plan. I know that we're all sort of conditioned and just in the habit of thinking that fall is the only time that we can make changes to our plans. But this podcast episode is going to teach you that that's not exactly the case and give you some information about other times that you'd be able to do that. So the first thing I want to do is start by talking about the enrollment periods for Medicare Part A and Part B. Medicare Part A and Part B there's 3 election periods for that. The first one is called IEP, or your initial election period. The second is called General Enrollment Period. And the last would be what's called a special enrollment or election period. We're going to start with the initial election period. If you go back to my very first episode, Medicare Basics, I do talk about this a little bit, but I just want to make sure that we're covering it again because today we're dedicated to election periods. So initial election period, this would be for Medicare Part A and Part B, is a 7-month window. Consider the month that you turn 65 to be your 0 month. So in my example here, January 10th, that happens to be my birthday. With a January 10th birthday, January would be my 0 month. And the very first day that Medicare could start for me would be January 1st. But what Medicare gives us is 3 months before we turn 65 to, figure out, do we even have to do it? Again, I'll cover it in my Medicare Basics, episode 1. Do we even have to have Medicare? Do I have to enroll? All those good questions. It gives us 3 months to figure that stuff out. So in my example with a January birthday, October 1st would be the very first day of my 7-month initial election period window. So October 1st is the first day that I would be able to enroll in Medicare Part A and Part B if it's not automatic. It's the first day that I would be able to make election or enrollment decisions about additional coverages like Medicare Advantage, Medicare Supplement, Medicare Part D. The thing about that 3 month before, that coverage is going to start January 1st because that's the day that I'm actually eligible. So that 3 month before is really that gearing up period. That's when we want to get answers to all those important questions. That's where we want to look at information like doctors, medications. But that 3 months before is when we really want to answer those questions and get our enrollment done for Medicare Part A and Part B, and potentially the other things, which we're going to spend the second half of our episode today talking about. Medicare also gives you 3 months after the month that you turn 65 to enroll in Medicare Part A and Part B. But that window of time has some different impacts. I don't think people realize that. I think they think, oh, I have 7 months. I can do it 3 months after. Why do I have to rush? The thing about the 3 month period after you turn 65 is that those enrollments are going to be delayed depending on when you actually make those enrollment elections. So after January 1st, right? So I didn't utilize that 3 months before, and now I'm in it's my birthday, and I'm like, oh shoot, I haven't done anything with Medicare. I probably should have done that. If I were to do an enrollment in January, what's going to happen is my Medicare Part A will still start January 1st. So Medicare Part A can always go back 6 months and will go back 6 months. So we don't have to worry about the Part A start date. But my Part B, if I request in January, would start February 1st. If I requested in February, would start March 1st. If I requested in April, would start May 1st. When I get to April 30th in this example, that is the last day of my 7-month initial election period, and I wouldn't be able to enroll in Medicare until I have another enrollment opportunity. So IEP is only that 7 months. It spans your birthday. It only happens once, and it's really a good idea to start engaging with your Medicare enrollments, decisions, questions prior to that first day of your IEP, which in this example was 10/1. So September, you probably really want to start thinking about it. So I think between the Medicare Basics episode 1 and what we just talked about with IEP, that should be really clear. If you do have questions, you can email info@onwithamanda. We like to get questions, so please feel free to send them. So if I mentioned, if you missed that 7-month window, you would need to enroll during another valid enrollment period. For Medicare Part A and Part B, so enrolling in Medicare A and B, there are only 2 others. So one would be the general enrollment period. This happens every January 1st to March 31st. This is when you could say, I didn't sign up for Medicare when I was eligible, but now I want to. During that 3-month window, right? So the first quarter of every year, general enrollment period would let you start Medicare Part A and Part B, depending on the month that you request it. So Medicare A can still go back 6 months. So if I ask for it in January, that would bring me back to, the previous year, late summer, early fall. But if you ask for Medicare Part B during the general enrollment period, the Part B, right, that medical outpatient coverage that you pay for, that piece is going to start the first day of the coming month. So I get to February, I'm like, ooh, missed my IEP. January was a blur, right? Recovering from the holidays. And now, boy, I really need to get my Medicare coverage going. If we do that in February, Medicare A is going to go back 6 months from February 1st. Medicare Part B is going to start March 1st. So that's the general enrollment period. Every year, once you get to April 1st, if you don't have Part A and or Part B, the only way that you would be able to enroll in that without waiting until the coming January when that general enrollment period rolls around again would be if you have what's called a special enrollment period. So most commonly, this is for folks who have worked past age 65 and have maintained credible group coverage benefits. And now they're approaching retirement. In the Medicare Basics episode 1, I also talk about coordination of benefit rules. So if you're still actively employed in large group, Medicare would actually be secondary to that group coverage. So that period of time, I usually tell people about 3 to 4 months before you're ready to retire. We can use what's called a special enrollment period where we submit some forms to Medicare. Your work will have to fill something out. It's called a form CMS-L, like Lisa 564, L564. It's a request for employer verification. And on that form, your employer is going to attest that you've had credible group coverage and that it currently hasn't ended. So that creates a special enrollment period for you outside of the general enrollment period that you can start Medicare anytime during the year. And that form is what helps avoid the Medicare Part B late enrollment penalties. So that form is really important. I feel like we spend a lot of our time helping people get those. They would be submitted to your local Social Security Administration. And I usually see the processing time anywhere between a week to 6 weeks. So that's why I think starting that enrollment process for Part B well in advance of retirement is a really good idea. So those are the 3 times that you can join Medicare A and B. You have your initial enrollment period, right? That 7 months around your 65th birthday, with your birth month being your 0 month. The general enrollment period, which is January 1st to March 31st every year. And then special enrollment period, which is a time where something is unique to your scenario, right? You've had credible coverage, you worked past 65, you still had group health insurance benefits, but now you're planning to retire or leave those group benefits. You don't even have to be retiring. You could just decide that maybe Medicare is a better fit now. So maybe some adult children came off your plan, and Medicare, when you're not taking them into consideration, might be a better fit than holding on to that group plan. So SEPs are a little flexible, but they do require documentation. So definitely reach out to somebody to get help with that. I find most human resources departments are pretty good about it, but forms update and we always have the latest version. So it's just good to have someone help you with that. So those are the enrollment periods for Medicare Part A and Part B. What I want to talk about next is, when can I make changes to my coverages beyond Medicare, right? My episode 2 conversation. So Medicare Supplement, Medicare Part D, Medicare Advantage. I think, like I mentioned, we're sort of conditioned to think we can only make changes from October 15th to December 7th. That is the annual election period, and that's certainly a very busy time for plan changes. But there actually is several others. So The first thing I want to mention is that going back to that IEP for Medicare, that IEP period, that 7 month, also is when you can join additional insurances. So if you're in your IEP for Medicare A and B, you are also in your IEP or initial enrollment period for adding a Medicare Advantage, adding a Part D plan, joining a Medicare supplement plan. Once you've used that, so once you've made your decision and everything's set, that IEP is over. Another time that you can make changes to or add coverages would be, it's called ICEP, so Initial Coverage Election Period. This is for folks in that scenario I was mentioning, maybe worked past 65 and now they're requesting Part B or Part A and Part B. ICEP is for folks who had Part A, never enrolled in Part B because they were still working, and now they've requested that. So they had A, now they're joining Part B. You can make an election to join a Medicare Advantage, a prescription drug plan, or a Medicare supplement plan before that Part B start date. So I'm going to give an example because this one is a little bit convoluted sometimes. So I'm retiring so today is June, it's early June. Maybe I'm retiring in September. I send in my Part B form, right? I'm 67, I send in my Part B forms, and I know that my Part B is going to start in September. I already had Part A when I turned 65. I can use the initial coverage election period to join a plan anytime until September 1st. I can't use ICEP after my Medicare Part B effective date. The start date for Part B is the end of that ICEP. So we have the 7 months, we have IEP, right, when we're turning 65. We have ICEP if we delayed Part B and now we're joining it. So that annual election period is that 3 month time at the end of the year, October 15th to December 7th, where anybody who has Medicare Part A and B can elect a new Medicare Advantage plan, could move to a Part D standalone plan, or could decide to keep their plan. The important thing about annual election period is that you have to know that your new coverage begins January 1st of the coming year. So really that's a period of time where we evaluate all the things that are important to our coverage decisions. Do I have new medications? Does my doctor still participate with a plan? What changes have happened in my health? What changes are happening with my plan, my co-pays, all those little things that are important. On the Part D side, are my medicines still covered as favorably as they were this year? So that's really a time to evaluate all of those questions and decide, I'm good where I am. If that's the case, then no action is required. If you find that another plan would work better for you, you would do that enrollment, and January 1st, your new coverage would start. A really good way to be prepared for annual election period is to keep an eye out for your annual notice of change. Those are required to be sent by your current insurance program. They're supposed to arrive right around the beginning of September, and it's going to highlight every single change that's going to happen in your plan. So if a copay goes up or goes down, they change maybe you have a plan with dental, they change your dental allowance. Anything that's changing in that plan has to be highlighted in that annual notice of change. So it's a really good thing to look at. So AEP, annual election period, October 15th to December 7th, that's when anybody can make a change to the coverage that they want to have for the coming year. Another enrollment period that people aren't familiar with, because it went away for a while, they actually brought it back. This will be the third year that we can use this election period again. It's called Medicare Advantage Open Enrollment Period. So this is only for folks who start January 1st in a Medicare Advantage or Part C, right? Medicare Advantage Part C plan. This is an enrollment period that gives you a little bit of time to find out, is my plan performing how I hoped it would be? Are my medicines covered as well as I hoped that they would be? So it's almost like trying out that new plan to make sure that it works. But Medicare Advantage runs from January 1st until March 31st of every year. So if you're in a Medicare Advantage plan, and for whatever reason, maybe a major change of health you weren't expecting, maybe you find that you got a new medicine that's not covered, you can address those concerns by enrolling in a different Medicare Advantage plan or moving back to traditional Medicare with standalone Part D anytime during that January 1st to March 31st period. So a bit more flexibility than people realize. I think it's smart that they did that. sometimes even as much due diligence as you can do, you might overlook something. So having a sort of a do-over the first quarter of the year is really helpful. The last election period that I want to talk about, which is funny because there's actually about 16 of them that are listed on the Medicare.gov site, what are called special election periods or special enrollment periods. This is when you have a special circumstance outside of IEP, outside of ICEP, outside of AEP, outside of Medicare Advantage, open enrollment period, where you could make a change during the year if you need to. So it's usually based on some sort of qualifying criteria, like maybe you've changed where you live. So you've moved to a new service area, you need to pick a new plan that's offered in that area. That would certainly be the case if you move and you're in a Medicare Advantage or a Part D plan, you would have to pick a new one. So changing where you live, losing coverage, so leaving a group insurance plan creates a special election period to join a Medicare Advantage or a Part D plan. Maybe having changes to your Medicaid level or your low income subsidy extra help level, that actually creates a special enrollment period so you can address that change and decide whether or not the plan that you're currently in is still the best option for you without those programs helping. So you move, you change where you live, you lose coverage, like you leave group insurance or you have a change to your Medicaid LIS. A common one in New York, and this is the one that we use most often from April 1st, right, the end of that Medicare Advantage open enrollment period. So from April 1st until the end of the year, belonging to your state's pharmacy assistance program, they're called SPAPs, State Pharmacy Assistance Programs. In New York, ours is called EPIC. Just belonging to that program, which does have some income qualifications. So this isn't about EPIC, but in New York State, that's what our state pharmacy assistance program is called. It's really designed to help with Part D copays for Medicare beneficiaries, but it does give you a rolling special election period. So anytime during the calendar year, you can make one change to your coverage. Make a change to your Medicare Advantage plan, go back to Part D, whatever fits that scenario. So belonging to this state pharmacy assistance program really helps that. Not all states have them, so I really do encourage you to find out whether or not your state does. If you're in New York, if you're watching from New York, I can assure you that we have one. The income threshold is $75,000 of income for an individual, $100,000 of income for a married couple. So pretty generous. A lot more people qualify for it than they realize, but that does give you a lot of flexibility in choosing your plan design. Another one would be another special election period or special enrollment period. So, I'm in a plan and I want to change it, would be if your plan changes its contract with Medicare. So let's say a plan decides it's not going to be offered next year. I've never seen a plan end mid-year ever, so I'm not saying it would happen, but if it did, you obviously wouldn't be stuck with no coverage. You'd be able to elect a new one. So if your plan changes its contract with Medicare, it gives you the opportunity to pick something different. So that's nice. A couple of other ones, there are actually 16 of these. And if you were to go to Medicare.gov and click on the little magnifying search icon and put in election periods, you'll see all of them that pop up. What's interesting is that some of the frequency with which you can use them, I see aren't exactly accurate, but it would be a good first start for, do I have any flexibility of making changes to my plans right now if I need to? And then when you reach out to somebody like us, whoever, they would let you know, yeah, that's not exactly right. Or yeah, absolutely. We can use that scenario to update your coverage. So Medicare.gov, just search special election period, and you'll see all the ones that are listed. So two others that I want to mention for special enrollment periods. If there is a plan in your area, a new plan that's offered that has a 5-star rating. So Medicare does star rate any prescription drug and Medicare Advantage Part C plan. And if there's one that's being offered in your area or gets an updated rating, that usually doesn't happen mid-year, you could choose to leave your current plan for that specific 5-star rated plan. So that's something that people can use sometimes. The last one, which is kind of interesting, is what's considered a FEMA declaration. So the Federal Emergency Management Agency, FEMA, right, that federal department, if they were to declare an emergency, sometimes severe weather is a very common one. So I was in an area that had extensive flooding, fire. We see these unfortunately more often in our country than maybe we used to, but hurricanes, things like that. What you'll typically see is that a FEMA declaration will be declared. And if you had another valid election period during the time frame that they declare that declaration that made you unable to make a change to your plan, they give you extra time to do that. So I had an election period, right? I was in Medicare Advantage open enrollment period. I was in my IEP, but something major happened with the weather around me, and it was a declared emergency. They would give you more time to elect plan coverages or make changes if you hadn't already. So if you did have a weather-related emergency, or sometimes I've seen them for gun violence, there's a lot of different reasons that they might declare one. So if you missed an election period because of something that was happening around you, I would connect to see if there has been an announced declaration that would allow you extra time to make a change to your plan. So hopefully you've learned that there is more than one option every year for most people to make changes to your plan. If you don't have anything other than the annual election period every year, it's really extra important that you pay attention to it during that period. Most times the Medicare Advantage open enrollment period can fix any issues that you might have overlooked. So I appreciate you taking the time to listen to this. If you have questions, please send them to info@imwithamanda.com. We love to get emails with questions, and we love to respond. So if you haven't had a chance to like and subscribe, please do that. And we'll see you next time. Thank you. Thanks for listening to another episode of the I'm with Amanda Medicare podcast. Please make sure to subscribe wherever you get your podcast so you don't miss an episode. Also, please leave a review, as that helps me reach more people that can benefit from this podcast's content. If you have questions or topics you want me to cover for a future episode, please email them to info@imwithamanda.com. I look forward to hearing from you. Like any good industry, we do have compliance requirements, so here's my disclosure. We are not a government agency. We are licensed insurance agents who discuss insurance programs such as Medicare Advantage, Medicare Supplements, and Medicare Part D prescription drug coverage. Any specific plan information I provide is limited to the plans I offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all of your options. Thank you.